Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
Well, in our opinion, of course, Bob.
New arthritis treatment of shoulders, hands, hips, knees, and feet. Maybe you can throw an elbow in there, Brad.
Sure.
It's new because we're doing a different combination.
Okay.
I'm calling it the 1-2 punch.
Oh.
And by the way, this video was done in cooperation with Thermatex, and they're the ones that are providing the one punch, which is infrared heat.
Okay.
So they have a whole family of infrared products, and family is a good word to use here because they're a family-owned company.
Sure, that is kind of
They've been
nice,
around for
Bob.
21 years up in Calgary. That's Canada.
Canada.
Right? Yeah.
Mm-hmm. Not Canada. Canada.
So we're going to show some of their products today, and then we're also going to show you what you do in combination with the product.
Okay.
So the idea is, Brad, a lot of, if you have an arthritic joint, let's say you have arthritic hands, they hurt, so you don't want to move them. And then they get stiff, and then they hurt even more.
So it kind of compounds.
Right. So the infrared heat is going to give you the comfort to knock that pain down and then allow you to stretch that joint.
So what's the big deal about infrared heat?
That's a good question, Brad. By the way, before I get sidelined here, Brad,
There you go.
if there's people that are new to our channel, please take a second to subscribe to us. We provide videos on how to stay healthy, fit, pain-free, and we upload every day. And we also would like you to come over to Facebook and like us, because it's sad and pathetic, but Brad and I don't have anybody that like us. So when you like us on Facebook, we feel like somebody cares.
Right. It's very important. Now, infrared heat.
Infrared heat. Okay, why is it different than regular heat?
Sure.
Regular heat will only penetrate a couple millimeters.
Sure.
That's Canadian talk.
Is it millimeters or centimeters?
Millimeters.
Okay.
But this will penetrate up to 60 millimeters, which converts to 6 centimeters, or how many inches, Brad?
2.36?
Yep, very good. He
So
calculated that in
over
his head.
2 inches, that's significant.
Right, so it goes this deep, the infrared rays or heat versus this. So,
And if you know your physics to understand why this works, we'd have to spend a whole other video on that, and we're not physicists.
the spectrum and all that.
But the wavelength and that kind of thing.
But what you'll find, Brad, I don't mean to cut you off, but what you'll find quite often, this is going to go all the way through the joint with the way we have it set up.
Right, particularly if you're doing it on your elbow joint or your wrist, you have the product
panels
on both sides.
Yeah.
You're going to have complete heat all the way through,
Right.
and get it to the joint where it needs to be.
And these are medical devices. They're registered with the FDA and Health Canada.
Okay.
So
excellent.
so let's take a joint, Brad. Let's talk about. By the way, the first one we're going to talk about, Brad, here. This product here is the Platinum product. And what's nice about this one, Brad, is that it can be used. It's universal. You can use this on every joint of the body.
Right.
Now, in addition to that, they have joint-specific ones, and we're going to show you those too.
Sure.
But we're going to start with the shoulder, and this one, it's got 3 panels. 1, 2, 3. And there's a hard side and there's a soft side.
Okay.
You want to put the hard side to the body, because that's the soft side is actually directing the waves into the body.
Sure.
So,
and imagine exercise, a little insulation too.
yeah, exactly. You got that right. They've got a nice cord. It's an 8-foot cord. I've really come to appreciate this, because whenever I sit in my favorite chair, I don't need to get an extension cord. I just pop this baby in.
And these are heavy-duty cords. They are built very well, and I believe they're hospital rated.
I'll bet you they are. And it's very easy. All you do is switch this on, and there's no rheostat for determining how heat.
Low, high, medium.
Right. No, it's just one setting.
Right.
And you put it on. You want to leave it on for at least 10 minutes before it kind of heats up. And then you want to leave it on for a good 30 to 45 minutes if you want to get the benefit.
So I think what Bob was saying, you'd probably turn it on. You may not want to put it on your body right away, because it won't be warm. It takes 10 minutes before things warm
I put it
up.
on my body right away.
Right, and yeah, you could do that, but don't expect to feel warmth right then.
Immediately, although I can start to feel it now. We got it plugged in.
Yeah.
So for the shoulder, you can just drape it over the shoulder like this. You can lean back. You can also, it comes with 2 straps, a long strap and a short strap. I got the short one on right now, Brad.
Here's the long one.
And I can just make a little, what's that, a tunnel? And you can slide it up like this.
Right, it's
Always cord go away from the body.
Sure.
So You can just slide it all the way up like this, and now it's in place on the shoulder.
Right. This is the type of thing, if you got a nice recliner, would probably
Yeah.
be a great piece of furniture that would make this so you can relax and let it do its work.
So again, because of the way the waves work, it does not have to conform right to the body. It just needs to be close to the body.
Okay,
So,
great.
you know, this works just fine. It doesn't need to be pressed up against you.
Sure,
I mean,
right.
the waves are going to work no matter which direction you have. So after you heat up the shoulder, then you're going to want to try to get some movement in the shoulder, Brad.
And how long do you suggest that we leave it on to heat
Again,
up?
they said 30 to 45 minutes.
Okay.
The regimen that they recommend is you go 2 times a day
Okay.
for at least 10 days or maybe 2 weeks. And then after that, you can drop down to once a day or whatever.
Okay.
Now, you know, this is a good thing to do in your leisure time.
Sure.
Because that's a lot of time.
Right.
So,
Good time to get some reading done.
Right. So after you heat up the shoulder, then you're going to want to stretch it in some manner.
Sure.
So, you know, one that we often have people start off with is just, you know, a little bit of pendulum
Sure.
like this. And then another one that we work on is working on extension, Brad. Do you mind giving me the white pole there?
Oh, yeah. A cane or a device like this, just a plain piece of
I'll
dolly.
go on this one. So you're going to start working the shoulder in this direction here. And
Bob, stand up tall, it's driving me nuts. to
sorry.
see this.
Again,
Posture.
what you find is that for every gain in motion that you can obtain, that decreases your pain levels in the shoulder. It spreads the forces out. And I've seen this again and again in patients.
Sure.
If you can get that range back, the pain levels go down.
Again, you may not gain the range all in one time, so don't push it really hard because you could overdo it. So do it with good judgment.
Now, we've got a whole bunch of stretches you can do for the shoulder. We just can't spend the time right now. Let's go to the hand and wrist, Brad.
Sure.
So this, by the way, you can use the platinum one for the hand and wrist. You can just create a muff like this.
Sure, yep.
And put it in there, and you can get both of them, and it'll do a real good job of heating up the hand and the wrist at the same
Sure.
time. If you'd like to, there's a joint-specific one they have here. Why don't you take this one,
Okay.
Brad? I'll take this one. Now, they're made for the left and right to some extent. Now, this one is the right one. You see, there's a thumb there, and what's nice about this is after you strap it in place, is that you can actually work with it on.
I'm going to put mine on the left. Bob's going to put his on the right. The devices are exactly the same, but if you put it on,
Now, this is getting mostly the wrist and somewhat the bones of the hand. It's not getting the fingers right now.
sure.
So, but yeah, again, because of the way this thing penetrates, it's penetrating, 2.36 inches. It's going all the way through the wrist joint.
Right.
Good for people who are having overuse syndrome in the wrist. I would try it for carpal tunnel. I
Sure.
would, without a doubt.
Yeah.
One thing, it keeps you in the flat position too.
Right, it neutralizes the joint
So now
mechanically.
you can take that same brace and flip it around and use it on the other side. So I can go on this side and, hook it up this way too.
A little easier with some help. We'll
Yeah.
do that. There we go.
Yeah. So now it's on the back of my hand. You know who this would work really well for, Brad, is gamers. I'm not kidding you. They get overuse syndromes because they spend so much time gaming, and there's professional gamers now that make a living
They
at this.
spend hours and
Yeah.
hours.
And so this is going to help your reflexes. This is going to help decrease the pain associated with that. We should almost do a whole video on that, Brad.
Right, just the circulation of benefits on this DP.
Right. So as far as stretches for the wrist, we'll just show 2, Brad. Do you want to show the wrist? These are the ones we do at the computer and stuff like that.
The ones for the muscle, the wrist extensors that pull up, and that's a common injury that gets some tendonitis, particularly up in the elbow. Is you go like this. Why don't you show them from the front, Bob? And then
that turn
we go down first, and then
turn out.
rotate out. Okay.
Great one for that, for the wrist and for the, like you said, the extensor wad here.
Right up in here. And you're going to do that, and you're going to hold that for 10 to 15 seconds. You could hold it longer if you want, and do it at least 3 times.
Okay, and then we're going to go ahead and stretch the other way
Yep,
too.
they'll get the muscles of flexors here, up here. And this, I don't like to have people go up to the tip of their fingers and pull. You don't really need to be that aggressive. Just here, particularly, if you got arthritis. These are gentle stretches. You don't want to get in there and crank and think no pain, no gain. Listen to your body, get that range of motion. And as far as holding it, Bob, do you like to hold it sustained or do the pressure
I
on?
like to do pressure on, pressure off.
Pressure on, pressure off.
Especially with the arthritis.
Sure.
To me, you can do both. Either way is fine.
Sure.
All right, let's go to the hip, Brad. I'm going to go back again to the Platinum model here. And again, you can just drape it on your hip like this.
Right.
You can actually sit on this thing too.
Sure, you bet.
And it works, well for the hamstring stuff. My wife is going to kill me for saying that. My wife did that one. So
Don't
anyway,
let her watch this one.
so you can heat up the hip really nicely, especially if you're having difficulty with it. And a good stretch that I love on the hip, Brad,
Yeah.
is so easy to do. If you sit like this, and if you sit and you put your leg up like this, and you see one knee's up like
Yep.
this, and you compare it to the other side, which is down,
Right.
that hip is tight, and that's a common area for it to be tight. And you can just work on giving it a stretch.
Right.
Pressure on, pressure off, pressure on, pressure off.
So in other words, we're going to take this and sit on it,
Yeah.
on that hip, you know,
Right.
so you get the hip, and you're not going to sit it all the way across your buttocks, but so you can cover that hip 40 minutes or so.
Yep, and you can do the stretch. I think you can do the stretches with that one.
Okay,
Yeah.
probably going to leave it warm up a little bit
Yeah,
first.
warm up first. I can feel it actually feels pretty good now because this has been heating up for a while already.
Yep,
So it's already in place. Let's go to the knee, Brad.
sure.
All right, they do have one, again, that's just specific for the knee. And this has got 2 panels. And you can put it, on the front of the knee, or you can get both panels on each side of the knee.
Sure.
And then it's got this little Velcro piece around that comes
Yep,
around like
come
that.
around, there we go.
So you could actually stand up with this even, and you could get
Right,
around a little bit
right.
with it. Again, the cord is going to limit you somewhat, but this one's actually heating up really nicely already too because it's been going for a while.
Mm-hmm.
And again, if you want to get maybe more quadricep or more hamstring, you can put it more right on the top like this,
Right.
or more on the bottom
The
like
heat
this.
on
if
this,
you want.
I've used the big one on my back, in my recliner, and it heats up to a comfortable warmth.
Right, it's
n-
consistent every time.
Right.
That's what's nice
and
about it.
it's not warm, but it's actually, they've done a really nice job on developing how much heat to put on there. It's so comfortable.
Yeah, it's wonderful. So again, you can also do that with the Platinum model, and with knee, one thing that a lot of times people are lacking is the extension. Let me use this real quick, Brad. Very common with arthritis. They're not able to fully straighten that knee. If you put both legs up, you might see one knee a little bit higher than the other because that one won't straighten out.
Sure.
So all we have people do is we go pressure on, pressure off. And again, you can do this with this in place real
Sure,
easy.
yeah.
Pressure on, pressure off, pressure on, pressure off.
Again, it's a
So-
gentle stretch. You're not going to get on it real hard and create real sharp pain. You're just kind of working with it gently.
All right, the last one, Brad, is the giant slipper or the magic slipper, they call it.
I'm glad I get to do this. I don't know what it is, but my feet in general over the last couple of years have been colder overall,
Oh yeah, and a lot of times people use these, they don't use it therapeutically all the time. Sometimes they just use it to keep warm.
Sure.
One girl had mentioned that when she goes into the office, she keeps it in her chair, and it warms her up during the winter months.
Oh.
Which in Canada
Not this.
is no.
No,
But you could do that with this
Sure.
too.
But this is what it looks like. It's got room to put both feet in. This one's warmed up already. I'm kind of anxious to get my feet in there. There's an additional cushion liner that you don't have to use it, but if you want to, if you're diabetic or you have some sensitive feet, you can put that in there as well. And
that's going to temper it a little bit.
so I can just imagine, using this, watching TV or reading a book on a cold winter night in Wisconsin and making those toes and ankles feel so much better.
There's 2 seasons in Wisconsin: road construction and winter. That's the
There
joke
you
around
go.
there. By the way, I wanted to call this the really big shoe. Do you remember Ed Sullivan? We have a really big shoe tonight. And he was talking about a really big show, but the joke was always, we have a really big shoe.
Yeah, for
This
the
is
people over 55 or 60, you might remember Ed.
You might know that. I don't really even know him. I just know who he is.
Yeah.
So
You're just saying that now.
along with that, you can do a good stretch, to the
wanna get
the
'em-
ankle when I'll show how to do the stretch.
Sure.
You can take a good stretch out strap like this, put it around the foot. This works out pretty good actually. And again, you're going to work on getting some more motion here. So I'm pulling it.
Yeah, show them the
this way toward
profile
me.
there.
So
Look
there we
at
go. Pressure on, pressure off, pressure on, pressure off. That's going to help that ankle. This would be good for plantar fasciitis too, Brad.
Sure,
Okay,
that would
works-
definitely
heats up that
get
bottom.
in there.
Yeah.
You know, I think that would be oftentimes we talk about doing that cross friction massage on the plantar fasciitis. Would be right after you get out of here and then work that. You'd have to see our other video for that possibly. You don't have time to get into it, but
All right.
boy,
Well,
I'm
we
gonna
spent a lot of time on these, but these are cool products. We got links below. You can go ahead and link and take a look at them and see what you think of them. So
okay, very good.
thanks for watching.